My name is David Eiton. I'm a student at OSU OKC in Paramedic Care 1. This is a report on my analysis paper. When I began looking for subjects, I was interested in technology that was beginning to take a role in pre-hospital care. The new technologies that we see with things getting smaller, the use of aerial drones in different applications and different things like that. And I was going to do a hodgepodge of different technologies and analyze their validity and their use in the pre-hospital scene after I began to delve into the many different research papers that were available to pull my information from. I realized I'd gone too far, so I narrowed it down to the use of point of care ultrasound in the pre-hospital scene. We'll look at the benefits, some of the challenges that are involved, and then the validity or the feasibility of using them in the scene. Is it actually useful? Is it pertinent? Is it something that is going to affect the patient outcome overall with cost effectiveness and different things like that? And so as we look at just the beginning, as the ultrasound's becoming something that's more prevalent, the hardware that used to be used for ultrasounds used to be big, it used to be bulky, but it's now in handheld size. It can hook into your phone or into a tablet with just one cable, and so as far as the equipment that you need, it can fit in both hands or really something in your pocket with the cable coming out. All the same challenges. You'll need gel, you'll need a kind of a stable area to look at to examine your patient. So some of the benefits are, as we look at this in pre-hospital use, the portability is one of the big benefits that's coming in. To be able to, this allows the paramedic to better diagnose and make better decisions on patient care, to have a better impact on prioritizing care and selecting the best treatment, and also the most suitable transport mode and destination. The ability to look at different to examine more deeply underneath the dermis and understand what's going on is why this is such an interesting and encouraging new technology that's coming out. The ability to confirm endotracheal tubes, gastric tube placement, and knowing that those are in the right place. We have ways of confirming that, but being able to see and readily confirm, missing that can be detrimental to patient care, and so being able to know that is very encouraging. Diagnosing intracranial bleeds and also fractures out on scene helps us to be able to make good decisions as to what needs to be done with this patient and how severe some of their injuries are. Blunt trauma to the thorax and to the abdomen many times leaves us with lots of questions as to what's going on inside. Being able to do point of care ultrasounds in the pre-hospital scene allows us to identify pneumothorax before it becomes tension pneumothorax, and to take the appropriate steps to treat that. This also is something that can be used in aeromedical transport as well, and so it's a tool that they can use to make some good decisions while they're trying to make their way to the hospital. Of course, this doesn't come without its challenges. With this new technology comes new training. Paramedics aren't trained in ultrasonography, how to interpret the different scans that we see. And so there are some studies that have gone about that show 1 to 2 day studies allow paramedics to have a decent amount of ability to interpret and identify different things such as pneumothorax, congestive heart failure caused by congestion heart failure, and also fractures. It's shown that the paramedics can do that, but at the same time, more technical things such as cardiac scans and different things like that are shown to be much more difficult to correctly identify with just a small amount of training. And so long-term training, as long as repetitive training to maintain those skills will be involved, which, while it's something that we do as paramedics, it is something that's going to be difficult as you bring about this new technology into the field. The other thing that it can cause is with the treatment of different diseases. Just because we scan something with an ultrasound doesn't mean that we can doesn't mean we have a positive negative that completely can rule out what we think might be going on. It doesn't always show us everything that we want to see, and sometimes it can be difficult to interpret. There are a lot of other really amazing things that are coming about with the ultrasound, having to do with things that I really didn't understand, so I didn't include them in my paper because I can't explain something I don't understand. But there's a lot of things that are coming into the future to be used. A flat, flexible, wearable scan that can be used to help to get hard sticks, to get venous access where it's difficult, where we can see underneath the skin and see the vein and see where we're missing. Also, that it's been put together where these patches actually can be bigger, can be put across the chest to do scans of the heart during cardiac emergencies. So the real question as we look at the ultrasound being used during the pre-hospital scene, and is it viable as a treatment? It's proved to be very viable as a tool to be used to help the paramedic to confirm treatments, to be able to see underneath the skin, to diagnose different things that can't be seen, free-flowing blood within the abdomen and different things like that. Different studies have shown that it is viable in diagnosing patients during pre-hospital scene to help with proper treatment and proper care of the patient. But the only thing that all the studies that I've read, and I read several studies that also read several other studies, is that is no clear data that says that the overall outcome of the patient benefits from pre-hospital ultrasounds. And so is it something that we need to jump on board right now and get on our rigs and on our boxes and get out there and be doing ultrasounds right now? From what I can tell, the information doesn't say that that's what we need to be doing. I believe that there's benefits that can be found in certain circumstances, but until a study can show that it viably changes the outcome, there are a lot of things that we use outside of the ultrascan in pre-hospital care, in pre-hospital scenes, that help us to identify and properly treat these same ailments as well. And so it's an interesting new technology that's come about. It has continued growth. It's going to continue to find new ways to benefit the paramedic in the pre-hospital scene, and I look forward to seeing what that might be.